everyone, this is Dr. Shiva. How you doing? Today we're going to be talking about what happens when you drink a high dose of caffeine, its effect on nitric oxide and particularly cardiovascular health. There's a lot of controversy around coffee and caffeine. That's why it's important to take a systems approach. Caffeine, by the way, is not only in coffee, it's in tea, it's in a bunch of substances. Now, one of the things that I think everyone needs to understand is the research on coffee or caffeine, frankly, was not done in any consistency. So what we're doing with our work at CytoSolve is to really hone in on different aspects, different dosages of caffeine, looking at 1 cup of coffee over a 24-hour period, the way we did these simulations with CytoSolve, or coffee over a 24-hour period. You do like 40 cups over a 24-hour period. And what you find is dosaging matters. So on the left side, you actually see the molecule of caffeine. It's the most widely taken psychoactive stimulant globally. It is also a natural pesticide, which is interesting. And it's naturally found in more than 60 plants. So it occurs in coffee beans, cacao, which is chocolate, cola nuts, guarana berries, tea leaves, yerba mate. When we look at the cardiovascular system, your cardiovascular system really has 3 subsystems: a heart, which is a pump, which pumps the blood vessels, and we're going to look at that, which carry the blood and nutrients to all sorts of the body. And then you have the actual blood, which is the transport. But the blood also has 2 parts: the blood cells, the red blood cells, and the plasma. The plasma supports your immune system, and the red blood cell supports the oxygenation system. So you have the arteries, you have the veins, but they're interconnected by the capillaries. The inner part of the arteries and the vein is composed of what's called the tunica intima, which is the endothelial cells. However, the capillaries only contain the endothelial cells. Over 35,000 research articles have been done on caffeine, over 1,600 clinical trials over a period of 55 years. So a lot of research has really kicked in on caffeine over the last 50 years. So how do you take all of these articles and figure out what's going on? So for my PhD work, as many of you know, many years ago at MIT, I created a platform. It was a technology called CytoSolve, where we can really look at, instead of cherry picking, which is a non-systems approach, we can look at it systematically, look at what the known research is, organize that literature. We can take all that knowledge, and then we can look at a particular molecular area. I wanted to let you know that we use the technology here. We've helped many companies over the last 16 years, a lot of smart, innovative companies, but we decided with all the mathematical models we've created, why don't we try to use this to compute the best product we could think of from the science out there for reducing pain and inflammation, pain and discomfort. And that resulted in us creating MV25 using CytoSolve. We're going to have more products that are going to be coming, but let me just show you what MV25 is about for those of you who haven't heard about it. But this is using CytoSolve in a beneficial way, not to just do research, but find combination therapies.
Hi, I'm Barbara Ann. My hands would cramp up so that I couldn't hold cards or knit or crochet, and they would go like that. And I'd have to use this when I played cards with my grandkids, and I started taking that MV25. After a bit, I was able to hold cards in my hand, very little cramping, hardly at all anymore. MV25.
Hi, my name is Sandy. I'm a Taekwondo instructor. I tore my ACL during Taekwondo. I had a lot of pain and limited mobility. I've been taking the MV25 for about 6 months now. After the first week, I noticed a big difference. After the second week, almost literally no pain.
My name is Jeremy, and I suffer from a lower back problem. Hurt my back at work years ago, and I can go to the chiropractor, do all kinds of different things, and nothing seems to help. And I decided to try MV25. I didn't notice a difference immediately, but within a few days, the pain went away, and it stayed away. I've continued to take it, and even when I do things that I shouldn't do, it seems to go away a lot quicker than it ever did before.
It's clean food certified. It's made in the US. If you go to vashiva.com, right on the shop, you'll click there, or you can go right to mv25.life, either way. And then from there, you can click on the bottle and you can order. If you buy 6 bottles, you get 6 bottles for free. Please take advantage of it, because first of all, it's going to help you. It's going to help our movement, and it really supports the fact that we want to take science-based approaches to natural products. So when we look at caffeine now, from that CytoSolve approach, what do we find? In many ways, it's a drug. You have to look at caffeine as really a medicine. It's a plant-derived methylxanthine alkaloids. Alkaloids are very powerful. Plant alkaloids can have psychoactive effects. So caffeine is a psychoactive. The average dietary caffeine consumption in the US adults is around 200 milligrams per day. So the average dietary consumption in the US adults People are essentially, it's like you taking 200 milligrams of caffeine. And the half-life in adults is 3 to 7 hours. What does half-life mean? That means if you consume 200 milligrams of caffeine, the amount that's in your blood when you first consume it, 3 hours later, you have about 100 milligram equivalent. 3 hours later, it'll go down to 50. 3 hours later, 25. That's called the half-life. For example, cannabinoids, things like pot, marijuana, have like a half-life, sometimes 10 days, right? So it takes 10 days for half of it to go away. So you accumulate this. So anyway, the half-life is important because it shows how much your liver can clear it. So you have a cup of coffee, and depends on an individual. If I have 1 cup of coffee in the middle of the day, it's hard for me to go to sleep at night. So it dissipates very slowly for me. Other people, they clear it quickly. So it depends on your appetite for it, all right? So that's why the half-life is important, is how much is taken out of your body over time. But that's the molecular structure. Now let's look at the biological effects. First of all, coffee is a stimulant for the nervous system. It is an anti-inflammatory. It's an antioxidant, and it is a diuretic, which means you drink it, you're going to remove water out of your system. What are the health benefits? It's got a number of health benefits. I'm sure most people know it makes you more alert. It increases your energy. It has anti-carcinogenic effects, anti-cancer, anti-neurodegenerative disease, Alzheimer's disease, and Parkinson's. It also improves your physical endurance and recovery. It reduces fatigue, improves focus, and does support weight loss. So those are the health benefits. Now, when you look at nitric oxide, its key role is maintaining blood pressure. It's anti-arthrogenic, and it's generated when endothelial nitric oxide synthase, which is an enzyme, catalyzes arginine. And so when you exercise, it triggers nitric oxide production. Here's your capillaries. In the inner surface of those capillaries has a endothelial cell. So you have these little endothelial cells. This is one cell. And on the cell surface, right over here, if you can see, is a very interesting structure. It looks like a Christmas tree right on the right side here. So when blood flows over these endothelial, this Christmas tree starts shaking. The mechanical force of the structure called the glycocalyx, when this moves, in the presence of arginine, release nitric oxide. What happens now when you take caffeine? So the y-axis is nitric oxide, and the x-axis is how much of that caffeine ends up in your blood at the cell surface, and it's micromolar amounts. So 1 cup of coffee over 24 hours, your nitric oxide level drops. It was at 100%, it drops down around 85%. Now, let's look at what happens if you drink 4 cups of coffee. When you drink 4 cups of coffee, you increase the level of caffeine in your blood plasma to 48 micromolar. You've reduced your nitric oxide production rate down from 100% to 78%. It's not that bad, but your NO levels are low. Now what we did was, there are supplements that bodybuilders take, or people who want to stay awake take, that are like the equivalent of 40 cups of coffee, where some people take a shot of this. So what happens when you take something like that? And what you see here is that when you take these caffeine supplements, which are the equivalent of 40 cups of coffee over 24 hours, you can see that your NO level drops down to 60%, from 100 to 60%. This is for a normal individual. There are people who have cardiovascular issues, hypertension. But the key takeaway from here is, what you can see is, as you take lots of caffeine in a short period of time, it will significantly reduce your NO production. So the issue again is dosaging. It's not about saying it's good or bad, but if you take a lot of caffeine in one shot, it's going to lower your NO production. And that is not good for cardiovascular health. And the way you can increase that, we'll talk about, is taking arginine. So arginine raises your NO production, as we talked about earlier. So let's wrap this up. So at the bottom line, as you consume more and more coffee, your NO production is going to go down. That's what the key takeaways. Again, the caveat here is you're consuming a lot of coffee, in this case, in a short period of time. This is equivalent of 40 cups of coffee. And by the way, this research, to let you know, it's documented. We published this in the Journal of Dietary Supplementation on caffeine. It was a research done with USP, US Pharmacopoeia. Again, I was one of the senior authors on it. So when we look at caffeine, we take that systems approach. You can look at it from a system standpoint. Coffee increases transport motion in your body. In the Eastern system science, they call it increasing Vata, transport. Coffee also increases conversion. You move faster. It's a diuretic, which means it increases the movement, the flow of water. You drink a lot of coffee, go to the bathroom a lot. And it also stabilizes kapha, which means storage. So that's what coffee does. Now, how much should you take? The daily consumption according to Navrat et al., is no more than 400 milligrams of coffee. Again, this is for the average individual, right? We know about 1 cup of coffee is around 200 milligrams to 400 milligrams of caffeine. That's seen as a consumption limit. For cognition improvement, about 150 milligrams per day, 150 milligrams. For headache, 300 to 500 milligrams per day. So that's what's known. Again, you should consult your doctor. This is not a medical show. This is essentially a distillation of what's out in the literature. Now, the adverse effects, which are also documented in the literature and the sciences, can get you very anxious. It can get you restless. It can cause blurred vision, insomnia, muscle twitches or tremors, elevated or irregular heart rate, and elevated blood pressure. Now, when you look at this, I just want to emphasize that this is, again, everyone's a unique person. There's some people who drink a lot of coffee, and they seem absolutely fine, right? Their systems may be different. This research is based on the norm that's coming out from those papers. So when we look at, by the way, the body from a systems Eastern approach, the anxiety and restlessness is called the Vata aspect. Some people already are very wired people. Obviously, if they take lots of coffee, it's going to wire them even more. So it depends on your body type. So that's important to remember. One size does not fit all. Again, that's what a systems approach teaches us. Everything I'm sharing with you has to be put in the context of you as a unique system. So in closing, caffeine is really a double-edged sword. And I want people to really remember this. That's why the research on coffee is not left or right. It's not pro or anti. So this is what people have to remember. Everyone will write me emails. Is caffeine good or bad? Again, you got to get away from this good, bad. It's about dosaging, and it's based on your particular situation. So there you go. That is our systems analysis on coffee. Thank you, everyone. Be well.